the 3 proven ways of reducing genital herpes transmission, and more. There are 3 main ways of decreasing the risk of genital herpes transmission. Using condoms, being treated with medication referred to as antiviral therapy, talking to your partner about your herpes diagnosis. Sadly, none of them offers 100% protection. A condom acts as a physical barrier, preventing contact with infected skin. It covers only a very small area of the male skin, the shaft of the penis, and it provides only partial protection because herpes may be transmitted via infected skin in other parts of a male's genital area. However, a condom covers the most important area because the penile shaft has thin, moist skin that is more easily damaged, which facilitates herpes transmission. Condoms reduce the rate of herpes transmission by 50% per couple over time, from 20.1% to 10.2%. Interestingly, condoms provide better protection for females engaging in sex with infected males, 96% per sexual act, than they do males engaging in sex with infected females, 65% per sexual act. This is explained by the fact that females have a larger genital area that has thin, moist skin, the vulva and vagina. More virus is shed by females because of this larger area. Antiviral medication, given in the correct dosage, suppresses the activity of the virus and helps an infected person's immune system keep in check. It reduces the rate of herpes transmission by 50%. So the rate of herpes transmission goes down from 20.1% without medication to 10.2% on medication. The third method of making herpes transmission less likely, as I mentioned, is talking to your partner. Research shows that letting your partner know you have herpes will help you both become educated, avoid unsafe practices, and use protection more effectively. Since preventative measures provide only partial protection, it's important to improve your knowledge about herpes and modify your behavior based on what you learn. Here is a list of things to keep in mind because they help reduce herpes transmission. Avoid sex and kissing during outbreaks. People are more contagious during herpes outbreaks because the fluid-filled blisters and sores have the highest concentration of the herpes virus. Pay attention to prodrome symptoms. Prodrome herpes symptoms are usually very nonspecific symptoms of fatigue, mild skin tingling, and shooting pain where outbreaks usually occur, either in the oral or genital area. Herpes virus is likely to shed during that period. Avoid skin trauma during sexual intercourse. Damaged skin is more susceptible to herpes infection. That's why it's recommended that you use silicone-based lubricants during vaginal or anal sex. Maintain proper hand hygiene. The herpes virus may stay on your hands after you touch the blisters or sores, and then you can easily transmit the infection by touching your partner. Wash your hands with soap after you touch your herpes lesions. Do not share utensils during oral herpes outbreaks. There is a theoretical risk, though the chance is unknown and considered to be extremely low, of herpes transmission via utensils. It's possible to exchange fluids, which contain the herpes virus, on utensils, and the skin around the mouth or inside the mouth, the oral mucosa, may come into contact with the virus.